Hello friends, myself Mohit Dangar and I will be discussed today is the ankylosing spondylitis. First of all, what is the meaning of the ankylosing spondylitis? Ankylosing means the stiffness and the spondylitis. Itis means the inflammation and spondyle means involvement of the spine. So spondylitis means the inflammation of the spine and the ankylosis is the stiffness. So whole word ankylosing spondylitis means the inflammation of the spine which involve the which result into the stiffness of the spine. Okay, so today's contents is the introductions, etiology, pathology, clinical features, investigation, and last is the treatment. First we have to discuss is introductions. So ankylosing spondylitis is the chronic disease, not a acute. It is a progressive, not sudden, and it is the inflammatory disease. So the ankylosing spondylitis is the chronic, progressive, and inflammatory disease. It affects mainly the axial skeletal, especially the sacroiliac joint. It affects the axial skeletal, not the peripheral skeletal. That is the key point to understand. That is a picture of the ankylosing spondylitis which affect the sacroiliac joint, and the upward progression of the disease will shown in this figure. Okay, now we have to discuss first is the etiology. Etiology means what? How the disease will cause. Okay, exact etiology is not known, but some genetic factors like genetic marker HLA-B27 it is associated with this disease. HLA-B27 is more than 1% in the 85% of the case of the ankylosing spondylitis. This figure is very important. So patient come with your clinic and complain about the chronic low back pain, it will result in the 5% of the chance of the ankylosing spondylitis. And the patient is complain about the inflammatory back pain, then the 14% chance of the ankylosing spondylitis. And that way clinical spondyloarthritis features it will 30 to 70%, and our big features HLA-B27 is 85%. And lastly we have to X-ray and MRI reading will shown, and it will confirm that the disease is the patient is suffering from ankylosing spondylitis. Okay, now next is the pathology. Mainly affect the sacroiliac joint as we all know, and then followed the upward lumbar spine, hip, knee, and manubriosternum joint is also affected. Okay, for in pathology is in 4 stage. First the synovitis of the spine will take place, then cartilaginous destruction will occur, then bony erosion, and in a later stage bony ankylosis will take place. It affect the ligament also, like anterior longitudinal ligament and other ligament of the spine. So ligament will affected, so the ligament will not work properly, so the movement of the spine will be restricted, and later then there is a permanently stiffness of the spine will be shown in this disease. Clinical features is mainly 2 types: presenting complaint and on examination. In presenting complaint, classical presentation and unusual presentation will be seen. Okay, first we have to discuss presenting complaint in that classical presentation. In classical presentation there will be complaint of pain and stiffness, pain in the early morning and the night, and this pain is go out when patient is walking or some exercises. Common site of pain is at heel, pubic symphysis, manubriosterni, and the costosternal joint. in stiffness, long time rest, and get up into the rest, it will be feel stiffness. It will be go after sometimes, because we have to early see in that after walking and some exercise it will go out. And these features is the key features of the ankylosis spondylitis. Second one is a unusual presentation. Some patient complain with the involvement of the hip, knee and the shoulder. Smaller joint are mainly not affected like wrist, metacarpophalangeal joint, etc. Bowel disease are also seen when the extremity joints are involved. Now we have to examination. In examination we have to divide it into the four part. We have to examine cervical spine, then thoracic spine, then lumbar spine, and last we have to examine the sacroiliac joint. First, in cervical spine. In cervical spine we have to perform the Fletcher's test. The patient stand with his heel and back against the wall and tries to touch the wall with the back of his head without the raising the chin. Inability to touch the head to the wall suggests the cervical spine involvement and cervical spondylitis. In figure you have to show that patient is not able to touch the wall, so the patient is suffering from the cervical spondylitis. In next we have to examine the thoracic spine. Only the measurement will be taken. Maximum chest expansion from the full expiration to the full inspiration is measured at the level of the nipple. A chest expansion less than 5 cm indicate the involvement of the costovertebral joint. And then lumbar spine only stiffness will be seen. There may be a loss of lumbar lordosis. Lumbar spine flexion may be limited, and the day-to-day activity will be limit, and it will be worsen our life. Okay, and last one is a sacroiliac joint. In sacroiliac joint examination we have to perform various tests like compression test, tenderness test, SLR test, pump handle test, and Ganslan's test. First we have to look at the compression test. In compression test, as you shown in the figure, patient position is a side lying. Therapist is apply the pressure over the patient's hip. If the patient complain the SI joint pain, it will indicate the positive test. Second test is a tenderness test. Tenderness is a present in the region of the posterior superior iliac spine or the deep in the gluteal region. Next is a SLR test. The patient is asked to lift the leg with knee extend. This will cause the pain at the affected sacroiliac joint. Next one is the pump handle test. In pump handle test you have to shown in the figure. Patient position is a supine lying. The examiner flex his hip and knee completely passively and forces the affected knee across the chest so as to bring it close to the opposite shoulder. This will cause the pain on the affected side, and the pain is felt, then the test is positive and patient is suffering from the SI joint spondylitis. Next and the last test is a Ganslan's test. In Ganslan's test, the hip and the knee joints of the opposite side are flexed to fix the pelvis, and the hip joint of the side under test is hyperextended over the edge of the table. This will exert a rotational strain over the sacroiliac joint and give rise to the pain. So that is all about the examination. Now we have to move on the investigation. In investigation part, we have to do radiological examination and the other examination. In radiological examination, we have to take the x-ray of the sacroiliac joint, lumbar spine, extremity, okay. And other investigation, we have to test at the ESR level, hemoglobin level. In ESR, we have to see that the ESR will be elevated and hemoglobin will be mild, anemia will be seen. ESR will be elevated because of the inflammatory disease. In any inflammatory disease, ESR always elevated, okay. And the next is HLA-B27 is positive. That point we have to covered. That is the x-ray of the sacroiliac joint involvement in the ankylosing spondylitis. That was the lumbar spine lateral view. That was also the lumbar spine. That first one is the frontal view, second one is a lateral view. In this figure, you have to see in that in normal x-ray, vertebral space will be more. And second figure, you have to see that the narrowing of the space is seen. So the stiffness of the lumbar spine will be seen in this x-ray, okay. And last, treatment part. Treatment are two-way. First is the conservative method and the second one is the operative method. In conservative method, you have to give the NSAID like indomethacin to relieve the pain, and physiotherapy treatment will be required. Radiotherapy and yoga therapy are also work in the patient of the ankylosing spondylitis. In physiotherapy treatment, we have to do some stretching exercise, aerobic exercise and the pulmonary exercise that you shown in this chart, okay. Then the last is a operative method. In operative method, spine osteotomy and the joint replacement surgery will be take place. Due to the kyphosis, spinal osteotomy will do, and some extremity joint involvement, we have to perform the joint replacement. So friends, this is all about the ankylosing spondylitis. Thank you for watching my video, and if you like my video, then don't forget to like and subscribe my video. Thank you.